So we have two more presentations for today. And the first presentation would be made by Vladimir Bulatov, who is the representative of AIPM. And this is an organization that helped us a lot in this conference. They supported us actively. Also, they supported our monography. And the topic of his presentation is real-world evidence of the near future. The floor is yours. You're welcome. Good afternoon, distinguished colleagues, dear friends. Hope you can hear me and you can see my slides. Yes, please start. First of all, for the invitation, all speakers and organizers of this conference. This really a big marathon devoted to such a very important topics, real-world evidence. So the day is coming to an end, but still the topic is very interesting because these are very different positions: academy, industry, clinicians, practitioners, patient community. So we need to know positions from all the sides. And the conference is really very interesting, and many thanks for the opportunity to participate as a speaker here. In my presentation, I'm happy to show the position of the industry on real-world evidence, real-world data. So what pharma thinks about it, how this area is changing, what trends do we see, again, from the point of industry. If we appreciate the areas around real-world evidence, what are the current trends here? I will put them into 5 categories. First, why the trials are carried out? What are the tasks organizers set? Those who organize real-world studies, what answers are looking for? Designs are changing. Now we have new, very interesting formats. The third one, definitely, this is the progress of technology, methods of analysis, tests. Again, it actually guides our approach to the data analysis and to the formation of evidence. Next one, partnership, because there are new sponsors, new groups, universities, patient communities, and they organize real-world studies themselves. So this is not just the issue of the industry that classically or traditionally is the sponsors or organizers of this trial. And last but not least, another topic, there are new sources of data, and this is also one of the trends, and it actually creates our near future. Let's try to analyze all the domains, and very briefly, I would like to comment on the most important trends. There are multiple reasons why we have to carry out real-world studies. It all started long ago. It started from post-marketing studies. Partially, that was a request of the regulators to demonstrate to what extent new drug or new product is safe and effective. And plus to that, the companies, manufacturers themselves, they organized this post-marketing study by a number of reasons. First of all, they wanted to see the efficacy in the real life, and then they had to make comparison with other options of treatment. So because if these tasks were not resolved by the randomized clinical trials, then they try to do it. And then also to analyze how the product is working in different subpopulations. Today, there is bigger interest in R&D, and we are actively using the data of real practice to improve our operational efficacy of R&D. And with big satisfaction, we can appreciate that this data is more frequently are taken by regulators to make registrational decisions. And today our Roche colleagues showed the example of registration of one of the oncology drugs. And we have our own example as Novartis Group when first genetic treatment for spinal muscle atrophy was submitted for the registration. And the study that was the pivotal study, it was open, non-randomized study, but as comparison group, as virtual comparison group, we used 2 other trials in the real practice. These are studies on the natural cause of spinal muscle atrophy. And so looking at the retrospective historical study and our results in the open label group. So this difference was a reason to register. Due to the COVID pandemic, definitely we saw lots of different observational non-randomized trials that clearly have to be taken into consideration for future decision making, for providing guidance and sharing experience for the future approaches to treatment. And the last thing, besides R&D, these are real-world studies. Real-world studies. They are requested by the budget holders, by the healthcare organizers. This is the second area, which probably is evolutionizing very actively and becoming more and more effective. And truly, healthcare focuses on the results, on the outcomes. So today, the manufacturers asking us, you should prove that your drug, your treatment is really working in the real practice, not simply influencing one parameter or surrogate marker, but also improving hard endpoints and also having particular budget advantages over the standard treatment. And we, as a pharmaceutical manufacturing, also asking this question, how to prove the budget holders and the payers this value of the new product. That is why successful pharmaceutical manufacturers developed and adapt their approaches to real-world evidence. Today, we appreciate statistics of Russian survey, and this is probably very similar international survey, where about 100 attendees responded, representatives of small and big pharma. Just two questions here from this questionnaire. So please appreciate the first one, whether the company is considering option carrying out real-world study before traditional phase 4. And about 1/3 of attendees accepted that. The second question, the use of innovative technologies and new types of studies for the generation of real-world evidence. And again, about 1/3, 1/3 of respondents um, agree with that. Not bad, not bad. But I think maybe in the future we can expect the growth of positive answers to such questions and the growth of popularity of real-world studies in the companies. There was another interesting question. In what areas do we most frequently use real-world evidence? According to the international data of this particular survey, oncology, immuno-oncology, immunology, and cardiology. So these are top areas where the real-world evidence is most frequently used at this moment. One more thing, design of the study. So here I'm putting our own experience and this is international experience. This is portfolio of real-world studies and how it changed for the last 15 years. Back in 2006, 2008, actually all the studies were carried out as Novartis Group. They were prospective non-interventional studies or post-marketing surveillance study. But if you look at the current portfolio, you see quite a lot. There are traditional randomized clinical trials, but here you see the real world evidence as a survey of the doctor, analysis of the patient's records, registries, and procurement of external data. So, and also social. So two types of studies that are of special interest that can guide the trend in the future among the designs. First is so-called enriched hybrid or combined studies, when in fact you look at retrospective data from different sources, electronic records or insurance companies' data. You make the big database, big massive, and then these, the same patients prospectively continued managed in the real practice, and then all this information is accumulated in a single database, and then data is getting unanimous, and finally they are pulled all into one. Very interesting hybrid or combined approach. And the second option, which we really appreciate, and we have some experience using this is so-called implementation science. Yet I have not seen the particular translation into Russian. This is study how the implementation into practice happening that already have some evidence base. For example, the survey for the self-diagnosis of the patient and whether it can facilitate the time for the correct diagnosis, or for example, to what extent patient schools together with programs of patient support lead to better result of treatment from the point of outcomes versus just drug treatment. So multiple studies like this, they require partnership and pharmaceutical companies on their own definitely cannot carry out such trials. The third area are the technologies. And today, we already mentioned multiple new technologies in Timur presentation, who is the representative of very technological company. Definitely, we do believe that these new technologies will finally guide the future of real-world evidence. This is machine studies, artificial intelligence, prospective analytics, semantic analysis of text massives. So multiple things from that, and all that facilitates our analysis of data. And as a result, we can use approaches of predictive analytics and so-called T-shaped evidence networks, T-sense, that allow to get complete holistic view on the disease based upon national databases or clinically enriched information. So one of our experience, this is a local designer of such technology or service, this is the use of semantic analysis with their understanding of the content. Here you see how from the text on the left, it could be patient records written by the doctor, or let's say particular post of doctor or patient in the internet, you can get structural information and then to get evidence-based data or some facts. It is clear that not every message could be considered the source of real world data. Definitely, there are limitations to these sources, but according to our experience, we can appreciate that you can get a lot of useful information from these sources. And correspondingly, when we start using these frontline analytical methods, uh, we change our understanding because traditional real world evidence try to reproduce RCT, but in real life. Mainly they use descriptive statistics and they try to respond the questions shown on the left. But now, using the methods mentioned above, the innovative analytical methods, we can get deep insights and so the questions real world evidence can answer are totally different. And these are issues of prediction, progression of the disease, or response to treatment. Next issue here is partnership, partnering. Here you see semantically how the sponsors looked like before, sponsors of real world evidence. Mainly, they were pharmaceutical companies, manufacturers, and just few studies that could be supported by any other party. But in the future, we share the position that definitely there will be many more stakeholders to carry out real world evidence, and that could be regulators and university community, medical community. So it's not surprising that online community, patient community, is not just a source but also initiator of real world data. And this is community patients like me, so that has lots of participants with big spectrum of diseases, and it is clear that patients like nobody else are interested that in medicine and in pharmacology there is particular progress, evolution, and methods of care will change for the better. And the last thing I would like to mention, what guides the trends. These are the sources of real world data. Today, we spoke a lot about it because about 15, 20 years ago, I saw the paper-based forms and the doctors were filling in and then we collected this information and that was the only source. But currently we have multiple sources of information. These are portable devices, then data collected by the hospitals, pharmacies, insurance companies, and what patients themselves present. So multiple options. And I think there are really big perspectives here in electronic charts, the analysis. Unfortunately, in Russia, this experience and the companies that are doing that, this is very limited. So we managed to participate in such project, which is devoted to the migraine analysis. So there were small companies providing this data, but unfortunately they terminated very soon. But the data was very interesting. We were welcoming these rubricators, these classificators that could provide legitimate access to such records. And this is how together we can get very useful information. And social networks, that's another interesting area. Again, COVID, when the patients could not get access to treatment, and it was telemedicine. So patients were using very actively all internet sources, Dr. Google, Dr. Yandex. Yes, they still exist, and definitely there are limitations in this method, but nevertheless, there are multiple advantages. Specifically, it is through the internet posts. You can get very transparent ideas, fears, worries, concerns of the patients. So you can get biographies, the disease course, and adverse events. And we can see from our own experience that patients of reporting of adverse events in the internet is much higher versus the real registration in the trials. And these are our publications. So here the results of the studies we received via social network analysis using semantics. So colleagues, let me skip the wrapping up. So here are my 5 conclusions, 5 areas I tackled in my presentation, and we believe that they will guide the trends in real-world evidence. So this is the questions real-world evidence is trying to answer: new designs, using innovative technologies, new analytical methods, partnership with regulators, with data generators, with patient communities, with medical communities, and using new sources of data. So all that will finally create the basis for real-world evidence in the future. Thank you very much for your attention. Thank you very much, Vladimir. So colleagues, please refer your questions, comments, remarks to the web chat. And this is the final presentation for today. And it will be made by Maxim Frolov.